This, like I said, was from what the Rockefeller Foundation did, and I loved it. And so they broke it down into these really simple messages, and I think it generally is applying everything we've talked about so far. So do your part. And this is something I use a lot. Let me open that chat so I can see. But as you can see, in this, it talks about what to do and what not to do. And really we find that the action of helping others create a sense of responsibility and agency. So like if others are doing it, I can and should do it myself. I'm going to create a sense of responsibility, but not shame. So we talk about positive aspiration for them to fulfill as a responsibility to others. And this is where I will say that instead of don't do this, you know, you don't get tested, you're putting other people at risk. It's what you can do to do something, and that's think of your closest friends and family. They'd take action. Think of your fellow burners, right? They want to help protect you. You can help protect others by doing this, by taking these steps. Want to build confidence and success instead of reinforcing their concerns. And that, again, might sound like you're like spinning something. People say, oh, I'm worried that a test might be painful. I'm worried if I get the vaccine, these other impacts, right? I provide to how many people have gotten the vaccine and how successful it's been, and that there are studies reflecting, you know, very little negative impact of, you know, reactions or whatnot from the vaccine so far that we know. And millions of people are doing their part, and you can do yours too. And then describe actions that people can take. This is a big one, right? Take steps, get tested, get vaccinated, find out, speak to others. Let them know that they might have been exposed so that they can take the steps necessary to protect themselves and their family. And at the bottom, it really talks about this. You want to highlight the stories that makes it personal, right? Emotional, visual, so we can begin to see or think of people that we know in our lives who have had doubts either about getting tested, but then it's worked out well. So success stories, that really helps. And then if you are going to be doing any messaging, this is also speaking to kind of, you know, organizations and public health authorities. It talks about placing messages in shared spaces and channels so that they can see those things. So if you are going to hold an event, you might even consider having some social media, you know, specific campaigns or messages that are about what steps that you're taking, if it's COVID related policies or practices. And really focus on that in the sense of it being simple, how people are doing their part, but then how it's a successful, you know, venture approach. Greg or Forrest, do you have anything you wanted to add about this? I know we spoke a bit about that.
Yeah, I'll add to this. This is another great opportunity to talk about the communal effort and tie these in with our 10 principles that we all share as regional burn events. And it's always great to use. That's, again, an example of the common language that we have of how we can tie together these practices of taking care of ourselves and others to those 10 principles.
Okay. The second component of their messaging is do it for them. And this is where we really put people in the picture. And you emphasize what steps they can take to participate in this burn, and that's what you're choosing to do, is something that's, again, emotional and evoking that visual sort of language. And that's where I talk about people's loved ones, or, you know, how are others in your household doing? I ask that question, not because I'm trying to like collect data, but because I care. And so in terms of that, when we are talking about contact tracing, that's something that, you know, we said it's kind of a nightmare to even think about doing at a burn. But there are some ways to kind of think about that is because of our concern for our burners, our community. You know, it could be concern for those that may be there who could be at higher risk of severe illness. And when we think we can visualize seeing that person, like I said, gate volunteers who may be having to talk to all of these different people coming through, you know, it's like essential frontline workers. it may help others to really consider why that's important, you know, because they're going to be coming through gate. And somebody before or after them might not have been as cautious. And then personal attributes or actions to build empathy. Like in this case, yeah, we do talk about the nurses or essential workers, people that are not able to take that time off or their jobs require them to be in those positions. And if you did have any kind of messaging that you want to do related to what people can do to do their part, you can see at the bottom it says bring it to life, and it could actually help to have pictures. Maybe that's somebody in your community that would want to, you know, be a part of something like that. I mean, again, this is just really from their perspective, but it helps to make that personal, even a personal story, which, I mean, a lot of my community members down here in Houston have done. They've gone on just, you know, on their own to say, this is how I'm affected by COVID, and this is how these steps can help to protect me. To people who have had positive stories and how they can model these changes and practices, I guess, that we want to see. Then before it's too late, do's and don'ts. And this is the one about urgency, which, you know, if there are any kind of time limits around people getting the vaccine to attend a burn, or getting tested to attend a burn, or even at the event itself, you know, with notifying someone if they're symptomatic. It's this sense of urgency. And for our perspective, it's really contact tracing and testing. But I want to just highlight something that is really interesting to me. And again, I've used this, where we want to give people you know, a positive action to do, steps to take, as opposed to what not to do, what to avoid. In this sense, they want to pair loss with gain to make that moment seem unique. And this is really describing something that will be gained by taking action, something that could be lost by not taking action. But it, you know, with those two paired, it gives people that sense of maybe real need for responsibility, and then also that satisfaction of saying, oh, but I can do something, like I can do my part for them, and it's urgent and immediate. So again, for more, event might be like, if you did have symptoms, why it's important not to wait till after, and be sure to tell someone now. You know, you see something, you say something, but in yourself. I like that there's a short window of time to pinpoint who else might have the virus before they could lose their health and their job. And also, most important, I think, with a lot of this is this immediate action, or these steps or practices that they're taking, and that they seem worthwhile, not just simple and easy, right? It's easy to get the vaccine, you know, it didn't hurt at all, right? That evokes, well, it might hurt, ooh, pain, and then it's easy. Well, sometimes things that are easy don't seem as valuable, but if you impress the fact that it's worthwhile, that it's important, then people will feel like it's something that they'll take the time to do. You could stop hundreds from getting sick by identifying just a handful of people that you've seen or been around, versus you probably haven't been in contact with that many people. Making a quick list of your contacts is no big deal. And then they talk about bringing, again, this to life using infographics. So they might show, you know, the timeline or spread of a virus if people took steps and if they didn't take steps. I think sometimes that can be a little confusing and also draw a lot of questions from people about, well, what data did you use? So I think having it be simple, especially for our perspective, is probably more important. Right. Now, in terms of what we're talking about from the organizer's perspective, we know a lot of burn events are still, you know, considering whether to even hold an event over the next year. And obviously you are familiar with a lot of the virtual events, some of the things we spoke about last night, and the ones that we know are moving forward, which was really great to hear from those folks yesterday. And we know that there are some people that have published, but I think many people feel like we discussed, it's all pretty early to make a final decision about it. And as we, you know, also talked about, it'd be important for us to, I think, continue to check in as those feel comfortable to see how things are going, right? With either feedback from the community, and public health authorities about what kind of steps people can take and what seems realistic. So we did talk about element 11 yesterday. I don't know if Janice was on this call, but I was really thankful for the information she had provided that was real specific about having proof of vaccination. And I believe it was at least 28 days. I was going to make sure to confirm. You all may know that we are considered to have full protection from the vaccine after 2 weeks. Let's say full efficacy of that vaccine, which obviously we know is not 100%. At 2 weeks after your second dose. And so it's interesting that they're putting another 2 weeks on that before the event start date. Proof of negative test. Now, I was unsure if this was correct too, if it was 2 weeks before the event start date as well. And just something to consider, you know, a lot of airlines do require you get a test within 3 days because it can take anywhere from 2 to 14 days for symptoms to present after we are exposed to COVID. So within that, generally, I mean, obviously public health authorities provide their info. I would advise if people were going to be using testing as a negative test in advance of an event to do what the airlines do as well, 3 to 2 days, because that is really how quick people can become symptomatic after exposure. Burning Man has their general guidelines. They have a COVID council that they task force, that they put together, and there is some information links at the end of this if you haven't checked out what they're doing. It's really interesting. And their main areas, of course, proof of vaccination, proof of negative test, rapid on-site testing, which element 11 will also have. Okay, thank you. Yeah, anyone who can clarify about element 11, and I'll just finish this, and then I'd love to hear whatever people think about either information here or any other events that you know and what their guidelines might be. Burning Man also had their antibody verification, which was also another interesting thing to consider. And then, of course, they're going to have a smaller, more spaced out footprint for Black Rock City. Okay, thank you. So it's 2 days for element 11. I'll update that. Thank you. And then Africa Burn, Greg had added this, that they're doing spaced out city planning, distinct event areas at a safe, reasonable distance from each other. So again, that's really their focus, is the city size so far. Anyone have anything you want to either add or questions about any of this information? We did have some clarity that it's information a little bit off.
There was a question about we could share the, I'm not sure if it was about this slideshow or the Rockefeller Foundation. That is public. That's a public document, right?
Yeah, Rockefeller is a public document online,
yeah.
And that's in that chat.
Yeah.
It's also at the end of this. But I'll also share this. I just want to make sure that I have the information that's correct about To the Moon. Great. Yeah, I'd love to include all of that. As much as you feel comfortable with sharing, again, so that we can just kind of have one place to have some of that information, at least for our purposes. But Cheesepan said To the Moon is looking at 2 to 3 days as well for testing, and they haven't yet finalized their decisions. Are there any other events that y'all know about that might have published policies or kind of considering different things maybe that aren't presented here? I saw there was something about NASCAR event.
There was something, and this wasn't like a burn event. Cat Six and I had gone to a Temple of Steaming Pot drive-through coffee and saw some burners there, and one had hosted an event just at his apartment that was kind of like their camp and had people come at different times. There was like the red group that was like, I'll be in the same area as you, but I don't want to get close to you at all. Then it was like the yellow of like, we can kind of get close-ish, you know, but I'm really cautious of my bubble. And then there was the green group where I think it was, I know you, so I'm going to like accept you as part of my pod. So it was like burners creating their own event, kind of establishing boundaries, but it wasn't like an event.
Right. I had heard about, yeah, something similar, and it was maybe a bit larger of an event like that. Maybe it was the same thing. kind of a big camp out, non-burner event in terms of it being private, company just throwing that. But that a friend that attended one said she thought it went really well. I think maybe it was only, 50 to 100 people, so not a large scale thing. And then of course, someone had mentioned temperature checks, right, as something also as an important part of measures that people are taking or could take and consider. All right.
So I mentioned in the chat that my organization, our Community Builders, is producing a COVID-friendly or COVID protocol safe and friendly public event. We've sold tickets by time slots. We're only allowing 10 cars on the property at any given time. The participants are expected to stay in their vehicles with the pod that they came with. And we're only charging per car, and we're tracking by license plate so that we don't have to have as much internal contact with the people coming through the gate. We had talked about doing temperature checks. We're not doing it for the participants coming through in their cars, but we are doing that for our safety volunteers who will come on the property to oversee gates and to be guides for the participants that will be coming through in their vehicles. Any vehicle is only allowed on the property for a maximum of 2 hours. Honestly, we don't have that many art pieces. I mean, it was an experiment, so our expectations were relatively low. But that said, I think that, they'll be able to get their dollars worth in like an hour, whatever, something like that, maybe half an hour. We'll see how it goes. Unfortunately, our event got postponed a couple of times due to stupidity and weather events. So we're looking forward to finally having it this Easter weekend, and we'll be able to tell you how it went. Ironically, however, the state of Texas is now open, which is dumb, but that's what our government decided to do. That said, we're going to stick to the fact that we designed this around mask wearing and social distancing and hand washing and all of that, right? The intention was always to honor the virus protocols, and we're going to stick to that. So that's our take on it.
Great, thank you. Were there any others anyone wanted to share about?
I have just a curiosity question for, I know some people have already determined that they're who's still contemplating having a burn this year? What are the mechanisms that they're kind of using to evaluate? What are they thinking will be their go, no go, et cetera?
So I don't know how to raise my hand on the desktop Zoom, but to the moon, our go, no go is roughly mid-June because we rescheduled. We're typically in mid-June for the event. We rescheduled to October to see how things play out and buy us a little more time before we have to make that decision. And we figure it's about 90 to 120 days to try to go make the event happen without completely burning out our leadership. So we figured our go, no go is mid-June because frankly, we can't afford to cancel again after canceling last year and losing land deposits and stuff. If we're not 99.9% confident that we'll be okay to go in October, then we cancel in mid-June. As far as go, no go dates, I mean.
Right.
Jilly Donut, hand up.
Go for it.
So we have confirmed that we are having our event next year, which is going to be February 2022. We've already booked the venue. And that's why I've been reaching out to some of you that have said you have plans that are in development. I'd love to get, maybe if there's a place on the Facebook page, we could have a depository, just delete the name of the event so we're not putting anyone at risk. So we can kind of see what the different, I guess doing benchmarking, what the different procedures are, because I think all of us at some point when we open are going to have to come up with safety protocols. I mean, this is not going away. It's just going to evolve and going to be incorporated into our event. So I'd love to see what other people are doing because I'm going to have to come up with one for our event for February.
Any other event organizers want to share? Go, no go dates?
Most of the people that I've talked to and most of the announcements that I've read, everybody seems to be doing the same exercise of working backwards on the calendar to what's the last date that they can reasonably make a decision, and they're waiting to see what develops. But they're picking their go no go dates based on what is it going to take to have the event, and as late as possible to let things evolve as much as they're going to. That seems to be the consensus.
Yeah. On Broken Spring, we're going to happen, spring break normally each year here in Houston area, and we have pushed that tentatively to the fall. There's a lot of other events that happen around here, including Renaissance Fair. So there's a lot of things to consider with our timing, but we have a good relationship with the property, so it's pretty flexible in that sense. And we're looking at 30 days out for our go no go date as well. But in terms of deciding, we're waiting a lot of other events decisions, such as Mischivia and Burning Man final. All right. Greg, would you share anything you wanted to say about Lakes of Fire? I mean, we have Lakes of Fire people on that could also speak about theirs.
That would be more appropriate, I think.
I can chime in. I'm Jen. I'm one of the board members from Lakes. And yeah, we laid out some criteria in our cancellation for this year. And I can drop a link if you want, but the idea was basically that it's allowed by our local authorities, and that we're able to meet safety and preparedness standards for a large outdoor multi-day event and have a critical mass of leads and a lot of the things people have been covering. But I can drop a link to our cancellation notice in the chat if anyone wants to look it over.
Great, thank you. I think Greg had pulled some of the info too from that into our slide because we really liked how you laid that out. And for sure, I know we spoke about this yesterday, the benefit of having polls, right? And surveying the community on different levels, the volunteers, and as well as the wider community. And Nurse Lance had an interesting thing of doing bulk buying of COVID rapid tests, across events. That'd be something interesting to consider. For those who know some testing folks, I do know some, but we could always kind of reach out on a wider level for that. It can get expensive, so for sure buying in bulk can help us save some money. Righty. So like we were talking about how to clarify, and we, like Forrest mentioned, having 10 principles and how to utilize that. We know that we all kind of understand the principles differently and how they apply. So that's just something to consider. But of course, I think that balancing, like we kind of talked about, of loss with gain, especially if people are talking about, radical self-reliance, and, I take care of myself, you take care of yourself, balancing that with other principles and how to identify the talking points for your volunteers to be able to communicate this. But for sure, if you do move forward and you can have a clear response about what people are doing to do their part, it can really help for anyone who might be, let's say, at an event and symptomatic and maybe not wanting to go take a rapid test, or, in advance, wanting to talk about forging a vaccination card. Whatever that is, it can help just to get the message out to the community, to your volunteers, and then through them, to your wider burn audience. And then, of course, I loved that Janice was talking about being in touch in Utah with the public health authority in the local area. They have epidemiologists that can give you really direct information about your area, the community, what issues there might be there more than others. So I think that's also a great idea. And of course, like we talked about, polling volunteers and community more widely. These were some of the resources. I know that we put some of those in the chat, and we can add some more. Like I said, you can have access to the PowerPoint itself. It's just a PDF, but that first one was the Burning Man had a really good February 2021 update. If you haven't read that, laid out some interesting parts of their approach. Then, of course, I think sharing information about where to get the vaccine and this Gavi vaccine link, just a vaccine alliance, they're doing COVAX, just sort of that national, international provision, distribution of the vaccine. But I really like some of the information they had, and the link here in particular broke down the 4 different types of vaccines in a really digestible, easy way to understand for people that might have concerns over an mRNA vaccine versus, more traditional type of vaccine. And then I also really like providing where to get the vaccine. So we've been putting that out in some of our newsletters and just information to share out there so that people can, again, see an obvious way to take steps to take action. And then our Texas website had both a map that was really easy to see and then that National Vaccine Finder link so that people can find that wherever they go. Right. Are there any other specific questions or points about what we talked about with any of the more recent slides or anything at all?
It also sounds like too, for organizers that are events are coming up a little later down the road, there may be some need for mentorship or guidance coming up with your own no-go criteria, and also participating in this weekend with the regional roundtable and this conversation are helpful in deciding that too. So thank you to everyone who provided links to show your your thought process on how you guys decided that, okay, we can go in this situation and not that.
Mm-hmm.
Once again, remember, we're part of a big team here, so big teamwork. We're all helping each other, even though we're really active in our own organizations, but that's why we all come together here.
In the Discord last night, kind of after stuff was wrapping up, there were a couple of things just a few of us were talking about is coming up when the first event is likely, it's the guinea pig for all of this. And I think there's going to be a lot of questions and a lot of, it's being mindful and respecting, people are making tough decisions. But then another aspect that's non-COVID related is that burn's going to be slammed with ticket requests because it's going to be the first burn that's happening in a year to 2 years. And so I think that that's another thing to be mindful of that's not COVID related, but a new nightmare. No one's really, it's trading information on how do people balance a ridiculous number of ticket requests at one time and keeping people in the community happy, et cetera, et cetera.
I know for the Southeast, a lot of burns allowed people, I don't know about nationwide, but a lot of burns allowed people to carry over their tickets from last year rather than get refunds. So a lot of the burns in the Southeast, it won't be as much of an issue because we either don't have tickets to sell or very few, just whatever, the only tickets we have available are ones where people wanted refunds last year. So it's going to be interesting because we really won't have to have much of a ticket sale.
I thought it was interesting. Burning Man's approach for the directed sale ticket approach would be to buy it knowing that if it did need to be, canceled, that you would basically only get a 75% refund. Isn't that correct? I don't know how others think about that kind of approach of going into it if you are looking to obviously sell tickets and move forward with some other either land rentals or whatnot aspects of putting on an event. Would you move forward with that kind of a guaranteed refund amount?
It's certainly an option, right? You have to understand, you have to balance out what are going to be your sunk costs for this situation. How much can you afford to put into this without getting it back, right? If your event runs event to event with only the money that you get from your ticket cycles, you might not have the savings that you need to suck up an event that you have to cancel and refund everybody your 75%. But if you planned ahead and said, we're only going to give you 75% because the rest of it has to go to overhead costs that we know we have to incur, then you should be okay. It's going to suck, but you should be okay, right? I don't know personally. We stick with the no refund policy, and so far we've been able to do go forward with that. But our community's been very forgiving so far. Most of the time, they're willing to just give up their ticket money to the event, to the community in general, as a donation, and just call it that, right? But so far, we haven't had to disappoint them 100%. We were successful in having a 2020 event before COVID arrived. And then, in 2021, we sold art tickets with the idea of trying to keep artists eating. And knowing that we might have to cancel or postpone 2021's event. So it's now to be determined. It's probably going to be a 2022 burn at this point, right? But obviously we didn't do 2021. Our replacement event was this COVID-friendly protocol, public event that we would sell tickets to, which we ended up incurring more money cost out of than it was, but it was a worthy event. We're glad we're putting it on. We're glad we're finally going to get a chance to have it, even though it was postponed twice. But an experiment. What else do you do? We didn't have to refund tickets. That was good. The people that bought those tickets mostly were willing to just give that money as a donation if we weren't able to provide something for them, right? So also thank you for my community, right? But not everyone's community is that forgiving.
There was a question we didn't really address last night, and if anyone had input, it came back up in the chat, which is, what would you do if someone was became COVID positive at the event, became symptomatic, tested positive with a rapid test? How would you respond?
I mean, from an event organizer's perspective, that's a great question, right? And that's one of the reasons that we chose to cancel for 2021, because there was a very high probability that somebody could come positive and then infect people, and then we would be held liable. How would we deal with that? We couldn't live with that responsibility on our head, and we weren't going to enforce contact tracing to that extent, because when you're talking about an event of more than 1,500 people, you can't, that's a lot of tracking, right? That's a huge responsibility. And none of us had dealt with a pandemic at all before. So this was all new stuff. Hence, we're not willing to take that liability. In 2022, the probability that someone's going to come to the event unvaccinated and or with symptoms are much lower. I mean, right? Because at this point, we're doing a good job. We're trying to do a good job of getting the vaccine out there and people educated and understanding, what it is we're trying to fight with that stupid virus, so that they can respect it and they can come and be honest and know that they didn't have symptoms when they showed up, and that we can feel safe being at the event. Until we feel that the community is ready for that, we won't have an event, because we're not willing to take that liability. It's just huge.
Any others? Went to the moon. Have you guys thought about that? Can't hear you.
Sorry, I'm still learning how to operate a mute button. With which factor on that?
If someone were to test positive at the event, become symptomatic and test positive, what would you do? What steps would your policies or guidelines be set up to do? Yeah, any ideas?
We're still working on that. Obviously, contact tracing is going to be a nightmare, but it's a high priority. Still trying to figure out how we notify people, balancing, okay, some people are going to get panicky or triggery, understandably, so you have to take precautions in how you notify, which probably would talk to our sanctuary T-based people about how to do that in an empathetic fashion. But that's your two top priorities, are contact tracing and notification of anybody who might be affected. And there's not a lot of good solutions we found yet, because contact tracing in a burn especially if it's with people not being sober and stuff like that. It's going to be tough.
Yeah, certainly. I know I've heard some people talking about whether it's, that idea of the wristbands, pod related kind of burn, either not agreements, but, kind of really theme camp based pods that try to be more isolated. At least if you go in with some kind of a disclaimer, and then you may be registering people in those particular areas, that gives you at least one step up. Aside from that, like, is it asking people to self-report when they go places, right? Check in some way, which is, restaurants that do that, they'll like list all, you write your name down when you walk in the door so that they can be one step ahead on the contact tracing. I mean, obviously that can feel really invasive, but those are some strategies people are doing.
I just don't see where asking people to register when they show up at a theme camp is going to be workable. Like, I don't think that people are going to necessarily do a very good job of that. And the people that are least likely to participate in that are frankly the people that are most likely to have been exposed. Because we have, I don't know about the rest of the country in the Southeast, we have a lot of people who still think this is a hoax and all of that. Yeah, there's not a good answer for us yet, and we're still trying to find a good answer because frankly, we need to have one before we can safely have the event.
I think
I concur. Oh, I was just agreeing, man, chiming in, totally singing through the choir.
I think there was some conversation about Ebola, and there are some guidelines that I think Sparky last night said that Burning Man had prepared already, and it'd be something interesting to look at too, is how at least guidelines that they have to apply. Obviously, this is so much wider scale that I don't know. Agreed. All right. Well, are there any other questions people wanted to address, or do y'all want to get a break from some meeting?
Quick question. Just because I made a note of the wristband things, I do like that. Which event was it, just so I could follow up and learn about how they're doing that, that's doing the wristband for pod thing?
Forrest, do you remember, it was what Lorette had gone to?
Is that where the wild things are event?
No, it had already happened. It was in the fall. Yeah. I'll see what we can find about that. Again, I know of the private event. I think Pinky might be speaking about that same one.
I just really liked that idea, so I wanted to follow up and get specifics.
Yeah, and it was interesting too. We had considered at the time if it was mask based, then you could even have red masks, green masks, yellow masks, something that would really indicate to people if it's not a wristband, something a little more visual. Certainly, if you had a red mask, we wondered a bit from a liability perspective if that was kind of saying, it's okay to not be safe, and maybe it's okay to not wear your mask, or give people some sort of green light to be less cautious, but definitely be an interesting signaler.
What if it was even giving them the choice to be prejudiced and group themselves together by color? Oh my gosh. But I do like the idea of the masks and the grouping. I mean, I don't know. It's an interesting concept, right? I could see how people would do it and be like, well, I know all of the people in my camp are vetted. We're good. Where everybody's had a vaccine and everybody trusts everybody's protocols. But the people outside my camp, well, they're iffy. I don't know. It's probably how people are going to act anyway. That's how they're going to naturally act when it happens. But when will it happen and when will it be safe? That's the question. None of us has that answer yet.
Right. Some other things we sort of threw around, we're doing building in themes, and maybe we were going to even have like we call them glam camp. They'll have that kind of different named, but you can build like your own 6-foot boundary out of, pool noodles or different kinds of materials, some way to get real crafty, but to actually create some physical distance from others. So some other ideas.
Just wear hoop skirts again, right?
Right.
It'll be the Victorian era all over again. Hoop skirts. Only they'll just be the net itself and nothing over it, right? It'll just be naked underneath. Just this big
with some LED lights.
Barrier. Yeah, I can see it. You can see it. I know you can see it.
We have to triple the size of all of our geodesic domes.
Yeah, so we won't be able to get in through the doorway.
One other thought I just had, like listening to conversation, is, for example, if you do have somebody who tests positive, now you're going to have a bunch of people who are part of this contact tracing, and you're going to get people who are pissed. And I think that taking into consideration what type of training rangers would need in sanctuary to mediate these situations, or just the I might have been exposed panic that comes on, in addition to, well, we need to isolate this person and do the nightmare of impossible contact tracing when people are moving around all the damn time.
Mm-hmm. In part, I know maybe Janice spoke about this too, as a disclaimer, right? Coming in would be a lot of education required for anyone before they even, when they bought their ticket, when they got to the event, right? Like orientation in a new way, and it would really kind of amp up that. So people would be a little bit prepared, obviously not emotionally, but even in some concept about what steps might have to be taken if someone were to test positive. Which some people tell me can be like a deterrent. If it's too gnarly, it seems too scary, they're not going to take the steps. They're not going to let us know. So that's kind of why really a lot of the messaging of that simple, actionable steps is important. And having rapid testing available. Keep in mind, though, of course, anyone who might have been exposed, it could take anywhere from 2 to 14 days for their symptoms to present. And we become infectious 2 days before our symptoms start. So it just really can make that complicated if it's like a 4-day event, 5-day event.
If there's time, I would like to hear from somebody in the profession about the viability, even the meaningfulness of contact tracing at an event like a regional burn. I mean, in the world, contact tracing is, I was at a restaurant the same evening that somebody who was infected was there. I didn't have to be sitting next to them. I didn't have to be talking to them. I was in the same place at the same time, which means that if I go to a regional burn of 700 or 1,000 people, and 2 days later we find out that somebody was probably infected, then everybody there is effectively a contact. I mean, do we do more granular tracing than that?
Yeah, because we do have large events. I mean, we have weddings that can be several hundred people, funerals, and that you've heard of those on the news, and people that have had outbreaks at those events. And what it is really personal responsibility of myself to consider, if I'm not going to tell the authorities, I alert those people. And that's really also important, right? I care less about us tracking those people, but getting the information out there. So that's, again, me doing my part and my sense of responsibility. Nathan?
I've got a question. What about offering an incentive to an event participants who have to cancel due to exposure issues? So that way people who for some reason wouldn't be able to attend or whatever, instead of being like, oh, maybe I can sneak in there, they're like, oh, well, it's not a problem because I get this benefit because I was exposed. Now I can't come.
Mm-hmm. Yeah, I think it's a great idea.
Pixel had a question.
Yeah, so I am not personally familiar with what the costs are of this technology, but it's pretty much probably exactly what would be needed for good contact tracing. If anyone knows anything about RFID wristbands, essentially, like, you can think of it as they're like short range. They don't require the battery in the wristband, just in the thing that tracks where you go around the burn. Like, the wristband itself is just kind of like a static thing that doesn't require an electrical source. So something like that, like, I don't know what the costs are on it at all, but I do know that that's used at all sorts of concerts. It's used at water parks, like, and it would actually give information. Like, if you walk into a theme camp, if like the sensors that are in that general area would pick up that you were there at the same time as other people. And like, it can actually record that kind of information,
Wow.
It's certainly possible, but it'd be pretty difficult because the sensors for those are typically installed permanently in places like the water parks and stuff like that. And they're very, very pricey to do all that. And to make pressure, not saying it's not possible for a burn, Additionally, as someone pointed out in the chat, there's also the definite privacy concerns with that. But it is theoretically possible to aid with contact tracing, but it's a very difficult solution to actually create in any kind of meaningful way. And also, because we also don't have like fixed in-points and out-points on these theme camps and stuff. Like I walked in the front of the theme camp and walked out the back, right? As opposed to like I went to the bathroom at the water park. Well, I had to go in and out the same entrance, so that's a lot easier to track. It's theoretically possible. Oh man, would it be a nightmare to try and implement in any kind of reasonable way at a burn type event?
Gotcha.
Any other topics or questions? Okay. Well, again, that big takeaway is us to kind of check back in. Go ahead. Nurse Lancelot?
Yeah. Yep. I think one of the big key things is that as many people vaccinated prior to the event, because if you're vaccinated, quarantine, and that's contact tracing, it reduces the risk overall. So, I mean, really pushing vaccination for our population so we can have a safe burn, I think is the goal.
Shared restroom infectivity concerns. What we do at work is you have hand sanitizer available, but basically you have to clean the toilet before and after you use it. That's one thing that we do. And it's really, again, radical self-reliance. Clean that toilet up.
Yeah, but that's in a place where it flushes and goes away. I mean, how do you do that with porta potties where the infectious materials is sitting there to contact anyone who goes in there?
We just use toilet paper and just like there's like hand sanitizer there. We just wipe the seat down. Can provide, trash. I mean, maybe it's an exceptional year for it. If you're using the Porto and I think hand sanitizer in there wouldn't be an issue though. If you're adding a lot of extra material, but.
That is one thing we're budgeting for with To the Moon is doing a higher porta potty per participant ratio. Won't help a lot, but at least it will help. Some people will theoretically be going in less close together because there will be more to choose from. I don't know how much it'll help, but it's something we're discussing.
And then we talked a lot about really having the theme camp step up in the same way that they would have a first aid kit, right? There's certain materials you can really, encourage them to have to be equipped for their camp and help kind of put a lot of that, again, personal responsibility, but in a more structured way, including even a theme camp registration, right? You're gonna have like a sanitizer, hygiene person or lead or whatever, liaison, some kind of same way that you might have other requirements. Yeah. It's a good point. If the human waste of a person is also infected and you're in a Porto, hadn't really considered that much, Ginger.
Yeah, I mean, the issue with restrooms at work is like, it aerosolizes as you use the toilet, but then it goes away. It goes down the toilet, everything's fine. When you're in a porta potty situation, the waste sits there. There is no flushing that away and then it goes away. And then if you just sanitize the toilet, it's fine. It sits there and is then infectious to everyone else who potentially uses that porta. So, a little extra factor there needs to be considered.
So what you just described was a big box of COVID waiting for you. That's awesome.
Definitely. Yeah. No, the solution in the Porto does not destroy the virus. It might prevent it from aerosolizing or capture it at least so it stays in the liquid. But yeah, I mean, we've all seen the shit show portas. Like,
oh God, yes. Oh, I don't even want to think about those. Thank you. They exist.
Never investigated it, but I always just assumed that whatever in the porta potties had some sort of sanitizing properties in there anyway.
It has odor control properties.
That is it.
It has a bit, but it is not definitive, and it definitely doesn't cover when the human waste exceeds the volume of the liquid, as often happens. And that's even at an event like Flipside where they're cleaned twice a day. At other events where they're not cleaned as often, that gets really bad really quick.
Oh yeah, we had one year where it was too muddy for the porta potty trucks to get in for 2 days.